Good evening and welcome to this fifth meeting of the Adult Social Care and Health Select Committee. I am Councillor Marwan El-Naji, the Select Committee Chair. This meeting is being held in accordance with recent government regulations on holding virtual meetings. Please bear with us if we run into any technical challenge during this meeting. In line with government guidance that everyone should stay at home as much as possible, this meeting is being held via Microsoft Teams live conference, and all the committee members, council officers, and the parties who wish to participate in this hearing are joining us from remote locations. The event is also streamed live, and members of the public and the media are welcome to follow the meeting remotely and listen to the discussion that's taking place. I would like to welcome any first-time viewers and listeners to this Adult Social Care and Health Select Committee. As in all our meetings, I think it would be appropriate for us to start with a 72-second silence to remember those who lost their lives in the Grenfell Tower fire tragedy. So can we have 72 seconds silence, please?
The 72 seconds has ended, Chair.
Thank you. Thank you, Yasmin. At the outset, I would like to ask members of the committee only to unmute their microphones and when they are addressing the meeting. Likewise, to save bandwidth, I would like to ask councillors only switch on their cameras when speaking, and remember to switch them off after they've spoken. If a councillor wishes to speak on a particular item and has not been called to speak, please indicate by typing the letter Q in the conversation column, or by using the hand up feature, or by drawing my attention just by holding their hand up. Please do not use the conversation column for other comments, as they can be seen by all participants and they are retained. To assist your fellow councillors, officers, and members of the public who are watching online to identify you, please state your name before you speak. If for any reason your connection drops out and you miss something, please can you let us know? In the event that my connection drops, I nominate my Vice Chair, Councillor Max Chauhan, to take over the meeting immediately. I confirm that I have no declaration of interest to make regarding any items on the agenda. I will now turn to my committee members. Could my members please Also, let us know if you have any declaration to make after introducing yourselves. So may I call to members, Councillor Chouhan.
Present. Thank you, Chair. Present and no declarations.
Thank you. Councillor Idris.
Good evening, everyone. Thank you, Chair. Councillor Idris, and I have nothing to declare.
Councillor Round. Councillor Spalding.
Good evening, Chairman.
Good evening.
Councillor Malcolm Spalding, Earls Court Ward, and I have no declarations of interest.
Thank you. Councillor Thaxter.
Good evening. Councillor Thaxter, St Helens Ward, no declaration of interest.
Councillor Williams.
Councillor Charles Williams, Redcliffe Ward, I have no declarations of interest.
Thank you. And may I have, we have a co-op team member, Diggers, please.
Hello, Christine Vigers from Healthwatch Central West London, no declarations.
Thank you. Thank you all. And I think I heard you all clearly. Do we have any apologies for absence?
No, we have no apologies for absence, Chair.
Okay, thank you, Yasmin. Can I now have the item 2? So we have all the declaration of interest. Anyone want to add anything?
Chair, we have the minutes of the last meeting.
Okay, on item 3, we have the minutes of the meeting that's been held on the 16th of December. I believe the minutes being circulated. If is it the wish of the committee that I can sign them as a correct record?
Agreed. Agreed.
Chairman, I did raise with you a correction to item A6.
Yes, I think Yasmin, she took that
right, and that's
item.
been corrected. That the what I was referring to was purely the Appleby report.
Yes.
Yeah, the minutes will be amended.
Thank you very much.
Yeah, thank you, Councillor Williams. And thanks, Fazmi, for taking action on that. Based on that amendments, can I sign the minutes as a correct record?
Yes, Chair. Thank you, Chair.
Agreed.
Okay. Thank you.
Agreed.
So I sign the minutes. Thank you. Thank you all. And now I move on to the main item, which is for the introduction to this committee meeting. And that's item A4, COVID-19. As a result of the current lockdown, our meeting tonight has been streamlined to deal with a single substantial item, which is the key current health and care matter, COVID-19 in public health and social care. This report sets out progress on vaccination and which is taken throughout the borough, the outbreak management, which is a critical aspects of our recovery, and the local testing strategy, which with the all logistics being throughout the borough, accompanied finally by the recovery planning. I will now invite the lead member, Councillor Jem Kamali, to briefly introduce the report. And I understand that both Councillor Kamali and Russell Stiles, who are our by-borough Deputy Director for Public Health, will be answering our questions tonight. May I welcome Councillor Kamali and Russell Stiles, please, to introduce the report. Thank you.
Good evening, Chair and committee members, and thank you for once again having us, as well as all the officers that are here tonight. As you'll be aware, that the report itself has a number of items which need to be updated, and I'm sure and officers will be able to give you verbal updates on the up-to-date figures. What I really want to sort of paint a picture is that the pandemic in Kensington and Chelsea has been atrocious. We're fully aware of that. This has been a national, international problem, but we in KNC have always been at the bottom of the not leaderboards, but we've been towards the bottom of the London case rates. This has changed somewhat recently. As you'll recall, the Kent variant obviously was present in Kent and in Essex and moved into East London initially. Currently, the highest case rates remain in Northwest London, one of the areas that had the spike last, and we're watching that fall quite quickly. But it has meant that our position in London has risen somewhat. But the flip side of this is that actually the important metric is to look at the case rate among our 60+ community. These are the people most vulnerable to coronavirus, and I'm quite happy to say that our case rate among that community is half that of the younger age group. So where our most vulnerable residents are placed in the borough are seeing a much lower case rate than the younger population. This could well be partly to do with the really successful vaccine rollout that we've seen across the borough and across the country. But it could also be to do with the lockdown that we're still in, and we now have a roadmap to get out of. One of the really key things that the council has been doing has been working with Northwest London and the CCGs to encourage take-up among our really diverse communities. There's an awful lot of community engagement work that's going along at the moment, and we're working even closer with our GPs and primary care networks to make sure that we can not just look at the headline figures, but look at the people that perhaps haven't been vaccinated, or if they've been asked, what their reasons for refusal, or whether they're just simply hesitant. So we're working really closely to identify what we can do as a council to encourage more vaccine take-up amongst all sections of the borough. The overall picture is very good. We obviously met the national target for February 15th on offering a vaccine to cohort 1 to 4, and we're now working alongside the vaccination hubs on the remaining cohorts for the middle of April. I'm sure the officers will be able to give you more specific figures on case rates and vaccination figures, but I must say that we are in the borough seeing an interesting breakdown of the figures, and that there's a very high willingness to take the vaccine, but there's clearly some local issues in that our population is very international, and we're trying to work out whether a percentage of people might have returned to Europe or gone abroad, or whether they're simply not in the borough at the moment. And that's something that affects our percentages, but doesn't actually affect the vaccines on the ground. People on the ground who are being asked to get vaccinated are coming forward to receive their vaccine, as I know a number of councillors here tonight have had themselves. And I'm more than happy to take questions. There's an awful lot going on. I think really positive news from the Prime Minister tonight, especially around care home visitation, but we can also see how our businesses will be able to adapt going forwards, and hopefully we'll have freedom in June. So I'll leave that with you, Chair. Thank you.
Thank you for this positive outlook. I wish it is by June. It is very optimistic. Would do you want Russell to Mr. Russell Stiles want to add any things you want to clarify on some of the diagram, or we go straight to the question? I will leave it to you.
I think it might be helpful to have the up-to-date figures from Russell. I know they get updated every day, and he'll have the latest figures. That
will be appreciated.
Yeah. Hi there, it's Natalia Clifford here for Public Health. I hope you're all doing very well. Can you see me?
Good evening, Natalia. Very clear. Yes.
Yeah, good. Nice to see you all. So the case rate today continues to be a good picture, just as Councillor Kamali says. So we're at 85.2 per 100,000 today, which is really great. And we're decreasing, just to give you a context to that, that's a 28% decrease compared to last week. And our neighbours around us in North West London continue to be higher, which is around 100 and 150 with our neighbouring there, probably to do with that surge in the new case variant there. So we watch closely with our neighbours, but we are definitely all coming down. In terms of that 60 plus, as Councillor Kamali says, we keep a very close eye on that 60 plus case rates, and that's also coming down. It's at 51.3% for the reasons I think that Councillor Kamali noted. I just wanted to also just draw attention to a couple of other good news stories, really. One is the positivity rate, which is at 5% now, so it's much lower than we've been before. We were at 25% before. And that's comparable now with London, which is at 5.4%. We're also comparable with London with our testing rates. So we're at 292.3, London's at 303.6. So it's a really good news story there in terms of our take-up of our testing and our positivity rates as well. That's the EPI update from me. Happy to take any questions.
Thank you. That's very positive. Are you worried in a way that's this sudden decline, if it's becoming so noticeable, for people to relax and be more? This can send an alarm, isn't it? In terms of being more cautious. How can we address that? Not to be overconfident.
Yeah, I think you're absolutely right. The key message is to remain vigilant. I think, the Prime Minister was very clear tonight, and the comms messaging that's come out to support that we'll be leaning into very closely here is absolutely the message is to still stay at home. Do not leave, there's no move to go back to the offices as well. So for all of our workers as well, just to remain at home for the foreseeable, to continue to use hands, face and space, aerate your rooms. So the messages are very, very clear. It's a slow and steady, but hopefully a hopeful move to the future, into the summer as that roadmap continues. And just to really stress, the message is very clearly, this is about data, not dates. So if we don't move along in terms of the 4 key dependencies around our case rates and the like and transmission risk, we won't move up into the tiers to get us out of restrictions. So I think we've really got a job there to keep on it. We've got very robust outbreak control processes. Our wardens are out there, door, out there in the parks and the like, and we need to continue that certainly as we head into the summer.
Okay, thank you. So the message is very clear now. Thank you for the clarification. Councillor Kamali, I can see you want to comment further, or I open it to the questions for my committee members.
I would just add that obviously, one of the things that the borough has been able to do to help is with our testing. At the moment, we are prioritising key workers and we're having a good steady stream of people coming for repeat testing. As lockdown lifts, I think it's even more important that people get in the habit of going and getting one of our rapid tests, because we absolutely have to find, especially when case rates are very low, we have to find those positives so that our local contact tracing teams can go into gear and work out who they may have come into contact to. It's obviously at the moment with such high cases, it's harder, but yeah.
Thank you. Okay, I will open it now to the committee members. So I will call to the first 3. Councillor Williams, Councillor Idris, and then Councillor Thaxter, and then Councillor Atkinson. So, Councillor Williams,
Chairman. Yes, 2 questions. The first was about vaccination. Again, can I add my congratulations and thanks to, particularly our GPs for the work they've done to really get us ahead of the curve on vaccination. But I understand that now the national plan is for GPs to focus on younger people with particular vulnerabilities, and the heavy lifting with the people in good health in their 50s and 60s will be done through people responding to the NHS letters and going to the mass vaccination centres. But there aren't any near us. What progress is being made on having a mass vaccination centre in or near the borough? My second question was related to support for schools. Of course, we had the news confirmation that all schools are going back, all pupils. What support are we giving? And one suggestion is, you mentioned community wardens. I mean, perhaps they can help be at the school gate to keep ensure social distancing amongst those coming to pick up children.
Thank you, Councillor Williams. To take the first point on the mass vaccination centre, we were hopeful to have one open at the beginning of February. This is obviously led by North West London. My understanding is it will be now towards the beginning of March. I'm not putting any bets on that, because the reasoning for having a mass vaccination site is to get through lots of vaccines. And what we need is to make sure that supply is readily available. The Prime Minister has clearly pulled forward the date for when he expects all adults in the country to be vaccinated. That leads me to suspect that vaccine supply is very good in the United Kingdom. And so I am hopeful that that vaccine hub will open. I should say that, yes, currently the target is actually 65 plus. That's where we are nationally. But you'll be fully aware of anecdotal evidence of friends and family who are under that age that are being vaccinated. And this is because our GPs are firstly using their list to make sure that anyone with an underlying health condition is being vaccinated, but also they are working through their own patient lists. And I have to say, and I would love to take credit, but it is the NHS that's doing this. They've been absolutely amazing at working through the various cohorts. We're doing very well locally on the 65 pluses, and I know that they are now working into the 60s. So they are working. All the vaccine they receive does get used, and they are able to do many thousands a week within the borough. And if you look at our sort of overall figures, there's around 55,000 patients in the 9 cohorts. And at the rate they've been able some weeks to do 8,000. So you can sort of infer from there how long it would actually take them to get through all of those people. With regards to schools, obviously it's sort of all recently been announced, but my understanding is that parents will be able to receive testing at home for them and their children. Testing will obviously remain one of the key issues, and our outbreak management plans, which I'm sure officers can give even more detail on, are already very good with schools. This isn't the first time schools have opened with COVID in the air, and they've been able to react. To your point on our community wardens, I'm happy to take that back. Really, I could talk to community safety on that. I think there is an awful lot of demand on their time at the moment with all the other lockdown related rules that they're dealing with, but I think that's something absolutely worth taking. And I don't know if there's an officer that wishes to update on schools a little bit more.
I can comment on that, Councillor Kamali, if that's helpful.
Yes, come in please, Natalie.
Yes, Natalia. So just 2 things on that really. The first thing to say is that already as part of our outbreak control plan, whenever we see outbreaks or hear any intelligence around lack of social distancing at school gates, we've actually used community wardens to go in there and work with the community. So we already have that as a really helpful resource, and we will continue to use that as we go forward, as we come out of lockdown. And from the 8th of March, we are of course expecting to see an increase in that sort of behaviours around school gates as well. The second thing I wanted to say around loads of support going into schools, supporting them to open again, primarily around testing. So primary schools, there was staff were testing twice a week, and in secondary schools, all secondary school pupils will be asked to have 3 tests before they start back, and they'll be tested twice a week as they go forward, and so with staff as well. And also in colleges, they also have an expectation as well around regular testing, and continue to have wearing masks in corridors, communal spaces, anywhere apart from when they're seated at their socially distanced desk. We work really closely with schools in terms of lots of different webinars, and of course through the outbreak control process to keep them open and of course safe.
Thank you, Natalie. Can I have Councillor Idris, please?
Yeah, thank you, Chair. Thank you, Jim and Natalia, for a very good brief. I have three questions. My first question is, you mentioned earlier that we were at the high end, but now we are at the where we're bottoming down in cases. And I was wondering, what do you attribute that change to? And the second question is refusal rates. Do you have a percentage on how many people, what percentage of people are offered the vaccine and refuse it? I'm curious to know. And also, have we looked at vaccine now that the schools are going to open? And I know they're probably going to close for summer holiday a little earlier. But my concern is there are some groups of students, especially students with special educational needs. They seem to be on the higher end of COVID patients. What are we doing anything special to vaccinate teachers and teachers of those students and these students? Have we considered maybe vaccinating them in school when they are there, because we can kind of like, instead of going around the community and looking for people here and there, if we can just, have we considered vaccinating them in school? These are my three questions. Thank you.
Thank you, Councillor Idris. If I take the last one first, so teachers for special education needs are included on our local list. So that's our social workers, our adult care workers, and also these teachers. So they absolutely are being included. To my knowledge, and I'm happy to be proven wrong, I don't believe anybody under the age of 16 is being given a vaccine nationally. But again, if someone please do jump in if that's incorrect. And then going backwards, so the refusal rates, this is something that is very important for us locally. We have to know not only what the rate is, but the reasons for refusal. At the moment, a huge amount of officer time is going into trying to analyze these figures. The headline figures are still good. If I try and pull them up, they're around the sort of 10 to 17% range of refusal. But the issue with that, as a headline, it makes it sound like 17% are refused. But within that 17%, we're finding that some residents are simply overseas, they're out of town, they're not near their GP, near their own home at the moment. So what we're trying to do is go through that information. And this is where our community engagement is so key, is actually there's some people which are refused for geographic reasons, some people that are refused for simply hesitancy. They're thinking that they might wait a little bit longer and then perhaps get the vaccine, and others which are just refusing for their own personal reasons. And we obviously have to try and encourage people that are hesitant that the vaccines are safe, and that's something that I know a number of councillors are helping with, as well as the officers and all of our community groups and faith groups. And for people that have just refused, that doesn't mean that they are now not eligible for a vaccine. We are still going to encourage as many people as possible to get vaccinated. It's not mandatory, but we are encouraging it. I think something that is worth noting is that of the people that have been asked to be vaccinated, so for instance, our care home residents, who we are obviously a closed group, we know where they are. We're at 90% have been vaccinated, and even that 90% could be better, because some care homes had outbreaks and you can't vaccinate into a home with an outbreak. So the work that the officers are doing is really pushing those figures up. Once we get our most vulnerable into those 90-95%, it's really important then to work through the cohorts going down. And as for your case rate, sorry, I don't want to paint a bad picture of KNC, but we used to be sort of the 30th, 31st borough in London, so very low case rates. We're now, as of tonight, around 18, 19. But for instance, number 1, 2 and 3 are Hounslow, Ealing and Hillingdon, which are all in our sort of northwest London areas. And you've got Hammersmith and Fulham, for instance, is 11. So there's clearly this surge that Natalia mentioned earlier has come to Northwest, and it's taking a little bit longer to filter through. But on a really positive note, looking at the government data, we haven't had a single case in the over 85 age groups and 90 plus since the 12th of February. So we've gone now 7 days, because there's a lag, 7 days without any cases in those age groups, and they're our most vulnerable. So really positive news on that. Thanks.
Thank you very much.
Thank you. That's a very positive notes there. Councillor Thaxter, please.
Thank you, Chair. And thank you, Officer, for your detailed report. I was just querying, at the start of the pandemic, 173 residents have died of the COVID, and 169 of these died within 28 days of the positive test. Can you tell me how many of these residents were from BAME background?
I'm afraid I don't have the figure on any of the documents on my screen, I'm afraid. Who would be the best person to answer Councillor Thaxter on that one? Officers, looking at you.
Hi, Councillor Thaxter. Thank you so much for that question, a very important question as well. And we can track some of that information. I'd have to get back to you after this meeting, if that's okay. I think that our death data has also gone up probably since the last time as well, because unfortunately it does go up week on week. So if I could get a proper picture to you afterwards, that'd be okay.
No problem. Thank you very much. Thanks.
Thanks, Councillor. Do you have more question, Councillor Thaxter? Your hand's still up.
Further on in the meeting, Chair.
Okay. So if I may remind you, put your hand down. Thanks. Councillor Atkinson, please. Then Christine Vigars after.
Thanks very much. My question sort of follows on from the previous one. I think this information, the information about figures, is very useful, and I appreciate it's a moving target all the time. But and I also appreciate, which I hadn't appreciated before, that there are different reasons why people don't take up the inoculation, and I presume at some point you'll be able to break that down so that you would be able to say who is genuinely refusing and who is just not here. I absolutely take that, but I do wonder do we have any figures now on the sort of differentiation of being ill and of taking the vaccine, broken down by different communities or ethnic groups? Or has that come under the answer that's already been given to Councillor Thaxter, that you don't have the figures at hand?
No, I do have some figures towards that. And Councillor Atkinson, this is something that's been really important to me, is that we don't just look at the headline figures of to me, the fact that 75% have been vaccinated is the irrelevant figure. The relevant figure is the 25 that haven't, because we need to know why. And it is something that it's very easy to vaccinate someone that's willing. The question is finding out the reasons why those who are somewhat less willing are refusing. As of the last bit of information I have, we're looking at around, and again, the issue of this is the way that they break down figures, because they're mixing communities based on sort of NHS breakdown. So we've got a sort of a decline rate of around 14% in Asian British, and it's around 19% for Black or Black British. There's then an other and not recorded, which are somewhere between 11 and 17 on those. Mixed is 16, and white is 11. So obviously, there is a difference there between white British and Black British, is the most stark difference. What we're really keen to do is to identify exactly those reasons. I think a more salient point is that of the Black British figures, there's been a sort of mid-50s uptake with a 19% decline, but that leaves 30% that have not indicated one way or the other. Yeah. And it also leaves, of that 19% or 18%, it's the reasons for decline. A lot of what we're picking up locally and through all of our communities is it's not a flat out refusal. It's simply, I want to give it a bit of time. I want to talk to my community, speak to my friends and family. And that's why our community engagement teams are spending so much time and effort doing this. But also, the flip side of this is also the people that are not here. So looking at sort of the breakdown across London, some areas sort of around Cadogan Gardens, which is very international, we're finding a very low take up. And now, is that because they're refusing, or is it simply because they're not there? So we are working with the NHS to get better figures. Our community engagement teams are working really hard on the local evidence, and there's a big package of, well, huge amount, frankly, with community champions, faith groups. All of our community groups are working to try and encourage that take up. So I think let's judge it on where we are a little bit further down the line. We're still in that first wave of first doses.
Yeah, that's all very helpful, and I have seen some of the efforts that are being made to contact people, and I think these multiple attempts from different angles is to be very is much to be welcomed. I am also I'm curious to know about you had a good figure for the residents of care homes. Do we have good figures on care workers and key workers and key workers generally?
Well, yes, it's not such a rosy picture on our care home staff. You'll have seen the national news around this. Our own borough, and to sort of set the scene, initially the first vaccines that were made available went to the residents. They were not aimed at the care home staff. It was directly at the residents. The staff were in sort of the second and third wave of care home visits, and we are in the 60% now for staff. But what I would say is a number of our homes have had outbreaks, and so we've not been able to go in and do vaccinations on them. We are now working, and Gareth, I believe, is on the call. His team are working incredibly hard, from even booking taxis to get people to vaccination centres, but also helping them, giving them lots of advice. But for instance, some care homes are in the 70-80%. Others, I won't name names, but there's one which did have an outbreak, and that's only at 45%. So on the care homes that didn't have outbreaks, we're very much in the 70s, but those that did are a bit lower, and that affects the average.
I just got a follow-on question from that, and then one more question, if the chair will. In terms of staff who are care workers, could you see a circumstances in the future where we, as the people that pay the bills, will be putting pressure on the care homes to ensure that their staff are vaccinated? Do you have a view on that? I think there's a duty to care of our residents, and part of that care will be around, wearing PPE and things like that. Vaccination is not mandatory. We live still in a free society that's able, you can make your own decisions. I think really what we're seeing with our staff is that they're not against the vaccine. It's simply a hesitancy, which our teams are working to break down. And each time we have an engagement session with them, we do book in more staff. I don't think the case law does not exist to mandate such a thing. I'm sure it will be talked about a lot in the coming few weeks and months with vaccine passports and those sorts of things. But fundamentally, we live in a free country, and they're not mandatory. And it would be up to each individual care home, in any case, to set their own requirements for work. Thank you. Chair, just a last question.
Thank you very much.
Sorry, I've got...
Yes, you can finalize.
Thank you very much. I was pleased to hear that we've got a system for teachers and school workers, which I think is proactive and much needed. And I think you said that it was 2 tests a week for teachers. Is there any way in which, in addition to taking tests, can teachers and school workers be given any priority in terms of actually getting the vaccination? I appreciate that older teachers will get it anyway, but are we allowed to interrupt the system to give priority to teachers or school workers if we wish to?
Councillor Atkinson, I think that is very much above my pay grade. that the
I can comment
NHS
on that.
rollout follows JCVI, but yeah, Natalia, go ahead.
Yeah.
Yes,
hi.
Natalia, please help there.
It's a very live question, actually, which is being debated everywhere, as you can imagine, or including through all the teachers' unions. So as we mentioned before, all of our teachers within our special school settings, but also any staff that teach within alternative provision in mainstream schools as well, have been invited to get their vaccine. We are not able to reroute the priority groups 1 to 9. Central government have been very clear that it is age and clinical extremely vulnerable is the predisposition for hospitalisation and extreme complications connected to COVID, and not occupation. And so they're not pulling forward occupation currently. And we currently don't have the ability to flex within that at the moment. But as I said, it's a very hot topic. It's being discussed globally as well. Lots happening in America. I'm sure you've seen all over the world. But currently we are in line with central government advice and guidance, which is to stick to the priority groups 1 to 9. Of course, many of our teachers will fit that group either through their priority group 6, which is those that have, asthma and things like that may be called forward if they have any vulnerability there, or because of their age. So they will hopefully be vaccinated, and everyone else will be within that. Within the next cohort. Just to say as well, Boris tonight has said that the end of July, hopefully, for every adult age over 16 to be vaccinated. So it's really not too long away. And
no,
of course,
but it is a whole term away. It is a whole term away for teachers. Yeah. And if we are, and I think quite correctly, we have decided to prioritise the return to schools, it would seem to me that you back that up. If you're asking people to take a more exposed position, I think there is a very good case to be said, in which case you can also you have the protection of the vaccine as early as possible.
Okay, thank you very much, Councillor Atkinson, for this interesting set of questions. I think it's been taken on board, and we know the government's guidelines there, as well as the capacity, perhaps, and there are various constraints. But yeah, thank you, Natalia, for that clarification. I would like now to go to Christine Vigars, please, then Councillor Chauhan, then Councillor Spalding.
Hi there, Christine Vigars, Health Watch Central West London. 2 questions. First of all, you say in the report that we don't have any borough-by-borough data on vaccination take-up. It was reported in the press over the weekend that the rate for over 80s in central West London, which is Westminster, and also Kensington and Chelsea, was low by comparison with other areas. So just a clarification on that. And if it is low, do we have any idea why that might be? And I just would throw in, is transport an issue?
Sorry, do you want your second question?
You can ask your second question, Christine, if you like.
I'll just sort of pose another one, which is following on from what was being asked about care home staff. Do we have any figures on the uptake among home care staff, the people who are going into people's homes?
Thank you. Yes, I did see those figures in the Daily Mail over the weekend and other places. Obviously, Northwest London are recording the number of vaccines which are given out by CCG, and we do have sight of those figures. There's always a lag on the number of vaccines, and there is also a huge amount of cross contamination of the vaccines, because occasionally it's people are not necessarily our residents that are being vaccinated in our borough, and likewise our residents in other boroughs. So when I saw those figures, this is something that we've been debating ourselves internally, is actually what is the true take-up figure, because Westminster and KNC do have a very large number of international residents. And we have a slightly different age population as well. So what we're working to the assumption is that there's been a bit of an exit from central London. I saw figures again last week that there's been about 700,000 people have left London. What we need to really establish is if you've been contacted and you are in borough and you've been vaccinated, is that all being recorded correctly? And likewise, if you're not in borough, are we keeping track of that? So that's the work that's ongoing at the moment. I should say that are being contacted. They are coming forward to get vaccinated. I think there's just this cohort of people that haven't answered for one reason or another, and that's why our community engagement is so important to get an answer one way or the other. As care home, but visiting care home staff, I'm going to go to Gareth Hall on that, who's got the really up-to-date figures for that, as we're able to track that a lot closer. They're employed.
Thank you, Councillor
Yes,
Talia.
Gareth, go ahead. Welcome.
Thanks, Chair.
Good evening.
Thank you. My name's Gareth Hall. I'm the Director of Integrated Commissioning. We have a better figure on the number of staff in Category 2 of the JCVI categorisation for vaccines. And that's the social care worker category. That includes home care workers, as you've asked about, but it also encompasses staff who work in day services, our own social care staff in adults and children's, staff who work with vulnerable homeless residents. So everybody who's in that kind of broader social care worker category comes in that number. We've done a lot of work to develop a reliable denominator for that, which is somewhere in the region of 2,700 staff who are working in Kensington and Chelsea. What we're working with our NHS colleagues on is a reliable way to apply a numerator to that denominator, partly because staff have been asked to access different vaccination sites that use different recording systems. So if you've been to a hospital site for your vaccine, you'll be booked on through the hospital system. If you go to the large vaccination site that exists in Wembley, not too far away, and there's a lot of capacity there, so a lot of people have gone, you're recorded through a national booking system. So our colleagues at Imperial College are helping to draw together that information in a way that would allow us to reliably quote a figure for that whole category and hopefully break that down into the categories within it, so that we could look at home care, we could look at homelessness services, etc. What we do know is that overall category figure is somewhere around the 40% mark at the moment, and that's across northwest London. So once we get that figure more clear from these different systems that are bringing it together, that will enable us then to work with the agencies where figures are perhaps lower to help them to increase their access in line with the sort of work we've done over recent weeks with staff in care homes.
Thank you very much.
Thank you, Gareth. I'm still not clear about the integration between the data. Can you elaborate a little bit on how does our data fit in as an RBKC? Do we have our own system as well?
No. So our role is really in setting the baseline figure, so understanding how many eligible staff there are in each of those categories, and then we receive booking information from the NHS, and largely that's now kind of being drawn together through the national system. But we've also had access to some of the hospital testing sites where hospitals have been vaccinating their own staff, and they said, well, actually social care staff could come here too. So some staff have gone to Chelsea and Westminster, they've gone to the Brompton, they've gone to the Imperial sites, and on occasion some social care staffs have been able to access the PCN sites, particularly the care home staff did that on a few occasions. Not all of those sites initially were using the same booking system. So in order to then bring those various spreadsheets and databases together, that's a bit of work that some of our academic colleagues are doing just to make sure that information is reliable, so that we can then do the job of saying, well, okay, we know that that agency that works in the north of the borough or that day service that's in the south of the borough has a lower representation of staff who've been vaccinated, and we can help them with the sort of advice that public health colleagues and others have been sharing. Yeah, because the data quality here is critical. If we are relying on data
for a future analysis and recovery, we need the clean data and data set. And using different database systems, it can create a serious problem for later integration. And I'm glad that you are at this early stage working with Imperial College or Imperial Health to address this issue at this stage. Otherwise, we are going down the road for a quite serious problem in data integration. And I know what it means. But thank you so much for that clarification. I would like Councillor Spalding, please.
Thank you, Chairman. If I could ask 3 questions that are all about testing. The first question is the lateral flow testing. I've used it myself at the town hall. It's fantastically well run. It's really efficient. You get a really quick result. I can't fault the work that this council has done to put that in place. Everybody there must be thanked by this committee. It's a fantastic service. So thanks for that. But my worry is those tests apparently are only about 60% accurate. And they are the very tests that are being used, the lateral flow tests, on staff who work in care homes. And they're only being tested once a week, unless there are cases. So it just seems to me it's a weakness that once a week and the lateral flow 60% accurate, that ought to be tightened up, because we know we've lost a lot of people who are resident in care homes. That's my first question or point. The second question is, we know that the PCR tests, I mean, they're more complicated, they're more expensive, they take longer to get the results. But those are going to be needed from June onwards if people are going to travel. The airlines and so on, and overseas countries are going to need some sort of vaccine passport, or they're going to need a recent negative test. Is the borough thinking about making that service available to residents? That's PCR testing. And the third question is the most important one. Now, we recently lost a very dear and a very wonderful disabled member of our Somali community, a dear lady who was loved by everybody. This lady had a care package at home. So she had care workers who came into her home. That really was the only contact she had, because she was isolating as a vulnerable person. So I'm very worried that visiting peripatetic care workers who go into people's homes are really a serious vector of transmission. And I'm wondering what is being done about testing the peripatetic care workers, because I think they are now a serious risk. Thank you.
Thank you, Councillor Spalding.
Thank you. Yeah.
I'll
go
answer
ahead,
what I can, and then if Gareth can jump in on perhaps that final point. Initially, so lateral flow testing, yes, they're not as accurate as PCR. I think that's the evidence is clear on that one. But what they are is readily available. So there's absolutely, and this is what we're encouraging, is if you are a key worker at the moment, and in the past we were encouraging residents as well, is get tested 2 or 3 times a week. We have ready supply. As you said, it's a wonderful service. The people working there, really enthusiastic. It's very quick, very easy. And we are looking to increase the number of testing centres we have in the borough, because we can now analyse where the people that are being tested are, so we know which areas have slightly lower testing. So on that, I would say just get more tests, absolutely. And PCRs, yes, they are much more accurate, but they are something that's provided by NHS Track and Trace. To my knowledge, it's not something the local council can hand out to residents or set up a service like that. I do know that there's a large number of private companies which are doing this for fit to fly certificates for international travel. And on your point of care homes, it's my understanding, and again, Gareth, do correct me, but they're tested weekly with a PCR, and then they're tested daily with a lateral flow only if a positive case is identified. So the intention is that, you know, they are getting the highest spec testing, and then it's followed up with the lateral flow if needed. And then Gareth, if you could perhaps answer Councillor Spalding on care at home as well, if possible.
Yes, certainly. That's correct in relation to care homes. It's weekly for a PCR test, and then every day for the LFT test. And indeed, staff are now able to order boxes of the LFT test for them to have at home before they even go to work. So they're not taking that LFT test at the workplace, hanging around for half an hour, potentially infecting somebody before they find out the result. So that's now able to happen before people come into work in a care home. For peripatetic care workers who are in a home care agency, they are also able to follow the same regime, and that was from the end of November that the government issued, the track and trace service issued that availability to home care workers to be tested weekly with a PCR test and to access LFT tests as and when needed. So that was in recognition of exactly the point that you've made there, Councillor Spalding, that particularly staff who are moving from one home to another are at strong risk of being a vector for vulnerable residents at home. The other thing that was done by government through us to support those agencies and those staff and the residents was the Infection Control Fund money, which a portion of which we distributed to home care agencies, having given the lion's share to care homes as required. And one of the conditions of distributing that money was to try to ensure as much as possible that staff had a limit to the number of residents that they were working with. So they weren't picking up shifts or covering cases that they wouldn't normally. That as much as possible, and you know, obviously there are limits to this. Staff were working with a consistent group of people.
Right. Yeah. Thank you. And can I follow up on this?
Could I make a comment?
Yes. Yes, Mary-Therese, please. Councillor Rossi. Yeah.
So Malcolm, I had a lateral flow test at the town hall. I tested positive. I was told to go home and self-isolate. So I went home to self-isolate, and then you go online or you phone up and you get sent a home test, which is a PCR, and then you send that off. And that came back negative for me. So what I'm saying is it might be inaccurate, but there is a follow-up afterwards. You get, if you test positive, you then get a PCR test. Okay?
But Councillor Rossi, when tested negative with the PCR, did you continue with your isolation?
No,
self-isolation?
Because
no.
I was released. I was released from the self-isolation because I had the PCR test came back negative, and then I could go out.
All right, thank you for clarification. Yeah, and the other thing I was just going to follow on care homes, since we are in more or less like in the monitoring when we give out these lump sum to avoid some kind of outbreak. What mechanism do we ensure? Do we have, as a council, do we have it in place to monitor? This is what's actually happening to avoid outbreak in care home. Do we have a specific mechanism to monitor?
Do you want me to come in on that, Chen? Okay, when the government issued the Infection Control Fund, it asked councils to distribute it, so we apportioned that out to each care home on a bed basis, and it came with effectively a contract that said you will agree to use this money in line with 6 criteria that the government has set out. One of those was about limiting the number of staff that would work with residents in the home. So there's a signed agreement from the home to say that they will use the money in that way. As we distribute the money on a monthly basis, now that we're in the second wave of it, we check with the care homes that it is being spent, so that where that's used to make sure that staff can isolate at home, for example, and still be paid, we're checking that that's happening. And also, as has happened since the outbreak of the pandemic in March last year, staff in our teams have been calling every home every day, partly to check on staff well-being and resident well-being, that the testing regime's working, that they have access to PPE, and those daily phone calls and relationships touch on all of these points. So we have a very good sense of whether those guidelines are being followed or not through a range of different mechanisms.
Right. And do we follow this one by a prompt visit in a safe way, of course?
No.
No.
So no,
So
I mean, that would be contrary to the guidelines. So we haven't been making visits.
All right. So at the moment, no visits whatsoever. Good.
Virtual.
Okay. Thank you, Gareth. Yeah. Okay. Excellent. Thank you so much. Councillor Johan, you've been very patient.
Thank you.
Yes, please.
I think waiting this long has meant that most of my questions have been answered, but they were around 3 areas of this document, and I'll just quickly maybe ask some follow-up questions, if that's okay, Chair.
Yes, by all means, Councillor Johan.
Thank you. I'll start by firstly thanking Chairman Natalia for an excellent presentation of all the data so far, and also to, is it Gareth who just spoke? Yeah, that's great. That from the CCG, that's very helpful. But my questions were going to be around the case rates, BME rates, and also about testings, in particular school. So I'll start with the kind of follow-up question that I had. That was about case rates. I'm aware that RBKNC case rates are like 0.6 per a day rate of about 0.6, which is almost zero. And I think Jem mentioned that we had no cases in the last month. Is that correct?
It's 9 days, I think.
9 days, right. So can I just say, how the figures of 0.6 per day, where does that come from? How is that calculated? That was from the national figure and database as well. So I'm just curious, if it's zero in the last week, 2 weeks, where does that day rate come from of 0.6 per 100,000?
Sorry, Max, I'm trying to figure. When you say 0.6 per 100,000, where you get
that was from the kind of London data, the published data, which I'm looking at from the local government data, and it's given 21st of the 2nd, 2021 as 0.6. I just wanted to understand what that figure was, and that's for Kensington and Chelsea.
Do you mean case rates or testing rates? Sorry, I'm trying to.
Sorry, is that Natalia? Yeah, sorry.
Yeah,
Thank you, Natalia. It's the daily. This is the problem of having difficulty understanding what the daily confirmed case rates of COVID-19 per 100,000 people in Kensington and Chelsea.
85.
85. Today is 85.
So it's and how does that translate to zero then?
No, sorry. So Max, there's on the government dashboard, they break down the case rates for ages 0 to 59 and for 60 plus. Our 60 plus age group is down to 48 per 100,000 at the moment. The 0 to 59 is at 96. So obviously there's an imbalance there. And the figure I was quoting was on the specimen date by age, which is also on the dashboard. And that's broken down in 5-year increments of population age. And in the 85 to 89, we haven't had a positive case since the 10th of February. And for 90 plus, it was the 11th of February. But obviously, there's a few days where the data is still being cleaned. We might.
That's very helpful. Thanks for that clarity.
Can I add, just Max, sorry, we've had 8 cases come through today, so very low numbers compared to.
That's great. Great news.
All ages, yeah.
Well, not great for the 8, but good news that we're heading downwards. Can I just also pick up on the BME rates? Are these available in terms of the data per ward or per area in our borough of Kensington and Chelsea?
to my knowledge, it's done more on lower super output areas rather than neatly aligning with the wards. But perhaps, Natalia, you can give a bit more detail on exactly how it's broken down.
Yeah, it's absolutely available at lower super output area. Councillor Chawan, we've got that information available.
And how will we get that provided by email or?
Yes, we can have that as an adjunct, no problem at all.
That'd be very helpful. And finally, so actually one more question on BME rates. I noticed on on the kind of on the recovery planning section item 7 and 7.2 in particular, it says that local data also shows residents from BME backgrounds are more likely to be at risk due to higher prevalence of diabetes and hypertension and obesity. And I mean, diabetes, hypertension is not kind of obviously specific to a BME group. And you've got comparative data for the two major ethnic groups in terms of visible minorities.
Natalia, again, do you have the breakdowns for that one?
Sorry, can I just get the clarity on the question? So
yes, certainly. Maybe it's not clear. It talks about the BME groups having diabetes, hypertension, and obesity as at greater risk. Is that in comparison with the same kind of group for, say, white residents as opposed to BME background?
Oh, I'm sorry. I think that's just the way it's been written. No, it just means that people with long-term conditions such as diabetes and then are all at the same risk, no matter what their ethnicity. But there is a predisposition within the BME community to have more of those long-term conditions for all sorts of reasons.
Yes, I think the reason why I'm
more likely.
That's helpful.
More likely, yeah. Thank you.
Yes, so just one final point about that. In the PHE report, in the first wave, it's suggested that the comorbidities, obesity, and occupation, if they were taken out of account, that the important factors, and if these important factors are corrected for, the risk of acquiring COVID-19 were greatly reduced. So it wasn't specifically related to the comorbidities, but other structural inequalities and related to social inequalities and access to healthcare. Can you just add a bit of comment to that and how that would be more applicable to 7.2?
Yes, I mean, absolutely. There's a lot of work being done on that at national, regional and local level. We know, for example, that you're much more likely to live in different housing structures, different types of occupation. So all sorts of reasons why people have more at risk to COVID, but also in terms of like higher viral loads, and then in terms of their complications due to COVID as well. Is that what you meant?
Yeah, and exposure to higher risk occupations. Some people had to go out to work because of structural inequalities and employment, the need to go to employment, and there were key workers or what do you call them now? Sorry, the key workers is the word I'm trying to find.
I think to add to that, Councillor Chan, is that we are very keen to sort of not just use that as a catch-all term. We have to really go into every community, because it's we're picking up anecdotally through our sort of Eastern European care workers, for instance, have a very different attitude to vaccination than our British care workers, for instance. And there's also a breakdown between different types of ethnicity and their reasons. And this is exactly why community engagement is so important, because a singular term that lumps everybody together is of no use when you're trying to find out exactly the personal reasons why they're slightly hesitant or they're refusing. So what our teams are really doing is trying to firstly use this data, and as you've heard tonight, the data is a little bit jumbled, and we're working really hard to cleanse it a bit and figure out exactly where the issues are. But on top of that, we have to then work out within our communities, and this is where our local councillors, local groups are so important. We get a very good understanding of which particular areas might not be having such high take up, and then we have to work on the engagement to improve that. So what we might do in say Nottingdale ward may be completely different to what we're doing in Colville, just across the road. So it's about making sure that our engagement is targeted, because we don't have the resource to reach everybody in the borough. So we have to really think it through as to what we're doing.
Thank you very much.
Yeah.
Thank you, Chair.
Yeah, thank you, Councillor. Yes, it's thank you, Councillor Schwan, for this quite interesting from a doctor probing into this kind of clarity, because it's a pandemic, it's health issue, it requires a quite very challenging. It requires some kind of innovation in terms of approach and working together to combat this pandemic. And now, if there is no member of the committee asking question, I think I can open it to other member of the community here. Anyone has any specific clarity, question, comments, help? If you can offer, as Councillor Kamali just highlighted, to bring down barriers? No? I think I will finish off here with just on the recovery planning. I think this is where it requires quite deep work together, where you finished off, Councillor Kamali, regarding cleansing these data, reaching the unreachable. And what I'm worried about is really the homeless people as well, people who have no quick access. How are we addressing it in our recovery plan? For example, addressing the inequality aspects for people on the street, because this will create fear as well of taking the vaccine, especially combating negative media. And this should be as part of the strategy for the recovery planning. And I will finish off with the on the aspects of involving the internal recovery board. What do you mean by that? Because this term is new to me. Can you clarify on that if you have the data there? Thank you.
Thank you. I think, firstly, yes, homeless people are included in this, and what we've also learned is, we do have a lot of people that perhaps don't even have NHS numbers, and we're working to make sure that they get included as well. So one thing on this that is so important is the recovery, but we're not doing this in isolation. We're working with our GPs. In fact, a lot of the community engagement is coming from the GPs. I know recently the Almanar, for instance, did webinars in Arabic, in English. Councillors from all parties are doing videos in all different languages to reach all of our different communities, and we're also finding that our GPs are willing to really put the time in on those slightly harder people to vaccinate. It's very easy to pick up the phone, ask someone to come, and if they say yes, great, that's easy. The ones which are taking more time do need the GPs to explain the procedure, explain how it's going to be, what they might feel, all those sorts of things, and they do take a lot more time. But the PCNs and our wonderful NHS teams are really putting in that extra effort to help. What we're trying to do is use the information they're gathering to find more people that might need this help and link them together. So there's an awful lot of sort of pop-up vaccination hubs you might have seen recently. Even something called a Vaxi Taxi to help people, be vaccinated all around the borough. We've had the fire brigade setting up tents. We've got community groups opening buildings. We're working with cultural groups, faith groups, all sorts of things to really make it so that people feel safe, secure in whichever venue works for them to be vaccinated. The recovery group that is obviously across council. There's a number of all the lead members are involved, and there's officers as well. We're looking at how we can really help our borough recover, and this is there's not going to be a single answer to this, so it's why it does involve everybody, and it's something we've got to figure out as we go along, because we need to look at the problems and identify solutions rather than just sort of jumping forward with lots of ideas without necessarily focusing on the right parts of the borough. So that's something that I'm sure will probably be going to OSC rather, I would assume.
the committee here. Okay, and the final one regarding the business community. How are we reaching out to them, because they are part of the transient community as well?
So from sort of my brief, we're obviously our teams are going out to encourage them to get tested. We've got a number of builders that come for repeat testing. A number of local construction companies are encouraging their staff. We've also got high street retail that's doing takeaway. So even sort of Starbucks employees know that there's testing available. Really, we're just trying to encourage anybody that's in the borough for whatever reason, if they're working, to get a test. From a wider perspective, I know my colleague Catherine Folks is engaging with businesses. I think this is the most the borough has ever engaged with businesses, because because they're needing support. We're helping with grants. We're identifying all the new legislation. We're going to help them with outdoor dining, al fresco life, all sorts of these things which are very much in her portfolio. But for us, it's about making sure that they know that there's support available for testing. And
yeah, that's what we are always aiming for, an integrated support from all angles as well, because we are all in it together. I think it's fair to say that there is no more question, and I really thank you all, Councillor Kamali and you, Natalia and Gareth, and all the team for putting this discussion to the right place, and working together for a fantastic recovery, heading for a good summer, I hope. Thank you, and thank you for your time.
Thank you, Chair and Committee, and to all the officers that are here tonight. There's quite a few, and I know they're all incredibly busy, so I'm sure they've probably got another 3 hours of work ahead of them this evening.
Yes,
so,
we are really grateful. Thank you for your openness with the community. Now, may I... Now we finish this section, which we are really grateful to all the officers and their hard work for the clarification. Now I move on to item A5. I think we are just on time. And this is the Select Committee Work Program report. As you know, our final agenda item is this work program. This report includes a summary of the topics prioritized and agreed at the 22nd of October 2020 Select Committee meeting, and an update on progress. The Select Committee is recommended to agree the progress made in the reviews. We have so far received reports on COVID-19 and adult social care and health at our October, December, and February meetings. We have reviewed adult safeguard also at our December meeting. These are two of the topics selected for review in our program for the year. As you know, the primary care will be reviewed as a single issue in our April meeting. And the preparation for this meeting is being led by Councillor Thexter with Christine Vigor's support. And of course, there's open for other volunteers to join their team. We had initially planned to review the response to the Appleby report on suicide prevention from CNWL, RBKC, and WLCCG tonight. However, health partners requested that we postponed this at least until April. Given the current extraordinary circumstances and pressure that they are facing, we have provisionally scheduled an additional date, possibly in early May, to address this issue. For us also to hold a public meeting to review this critical and important issue. I will invite members to discuss progress on the review topics on mental health in North Kensington, which is a working group led by Councillor Williams with Councillor Atkinson and Councillor Idris and associated team members. So may I call on Councillor Williams, please, if you can give us just an update on this. Thank you.
Yes, we've had a discussion with officers, and the thing is there's a number of community consultations going ahead at the moment by adult social care, children's services and public health, and we want and we felt that it would be an overload to sort of have another community engagement, because we feel at the moment we're not going to get a great deal of involvement from the statutory services because of the pressures of the pandemic. Unfortunately, there's further complication now, which is which officers are looking into, which is the PERDA period for the London elections, which is going to kick in, I think, about the 22nd of March, which I think might or might not mean a further delay. But I think my plan, the others may wish to comment as well, is that we go to the community organisations before we go to the statutory partners to understand what they consider the issues are.
Thank you, Councillor Williams. This is appreciated, and I know we are operating into double constraints here in this, but thank you for your work and your plan to get this one moving on. I have no further comments on this unless your other members of the committee wants to add anything, or we'll finish at that point. Yeah. Councillor Williams.
Thank you.
Thank you so much. And this will finish these two working groups. To supplement this work on mental health, I reached out to Professor Monica and her research team at Brunel University, and they are especially regarding the exploring the differences in digital technology interaction. So this is a side issue to capture the engagement of our residents for their well-being and during COVID and this pandemic. So her research team, through her own grant, they are doing this work with us in North Kensington within the 500 meters, try to address this issue. And this is complementing the work already we have in the council with the digital inclusion team. So I hope her work as well will feed into what you are doing, Councillor Williams, and I will introduce you to her because she is already now engaged with the councillors in the council. Yes, and this will be supplementing to some of the work we are doing as a council and as your working group. And I will introduce you to her and her team later. Thank you so much, Councillor Williams, for this. I have no more further things to say on item A6. I will call on the officers if we have. That's the. I don't have any other business except Councillor. Jackie, I would like you to enter here into this, or Paula, if you want to add any comments before I move on the other business, please. Because I have Councillor Spalding, he has the 3 things he has to say.
No, thank you, Chair. No, nothing to add.
Thank you so much, Jackie, and for all the work and the guidance you are giving this committee. So I will leave it now to the Councillor Spalding to ask his question or participation.
I'd also like to thank Jackie Hurd for the help and support she's been giving to Councillor Dorian, Councillor Wade and me. The 3 Earls Court ward councillors came to you, Chairman, and you granted us a councillor's call to action. And the protocol of this is that we will go away and do our research and write a report. We were going to bring it back to you, but it's got several cross-cutting themes. It's to do with housing, it's to do with ASB and crime, and it's to do with well-being and safety of people in social housing. Because there have been some rather erroneous placements into the wrong type of housing that has led to all sorts of problems, and all kinds of officers who had to get involved. And we're trying to get to the root of it. So Councillor Rossi very kindly has agreed to take it to OSC. I would just report to you, though, briefly, before it goes to OSC, probably in April, we took your permission. So we held 3 meetings with housing officers. And we've got lots of good data, and Miss Hurd is getting us some more stats. We've had 1 meeting with Councillor Will on the ASB and community safety side. We've had a meeting with Councillor Thalasites about the way that planning can improve some of this very poor housing that we've got. We've had 1 meeting with Councillor Taylor-Smith about the future of the kind of mix of housing that we're going to have in the ward. We've had 2 meetings with the MP, Felicity Buchan, who's been extremely helpful, has really understood the problem, has got on top of it, and is really supporting everything we're trying to do. So next we're going to have some meetings with what they call registered providers, i.e. housing associations, and how they can increase their level of support to their vulnerable residents. And then we're going to have some meetings with the police. And when we've put all this together, and Miss Hurd has had a look at the report, when it's in the suitable shape, it will be going to OSC and not back to this committee, Chairman. So I don't know if you've got any questions, but that's my only other business.
Thank you very much for all these positive efforts, and this is the work you've done in progress, and you can see the results there. This is a cross dimension, so thank you for your work there. Anyone want to ask question on that? Otherwise, I need to sum up and conclude this meeting. Councillor Atkinson, I can see your hand up.
Thank you very much, Chair. I just wanted to ask, I mean, I thought the information we got from tonight's meeting about progress around COVID was extremely good. It's a very valuable meeting. But I am concerned about the likelihood, or I think actually the certainty, that the priority that's being given to COVID is leading to backlogs in other areas of NHS concern and treatment. And I wondered if at some point we can ask for, sometime soon, we can ask for a report back on what is happening elsewhere in local services for things other than COVID. And I mean, there's been this curious announcement as well by the Health Secretary about a further reorganisation of the NHS, which I appreciate there seems to be very little detail yet, and I'm not even sure when a white paper would come out. But my understanding is that the reorganisation painfully carried out by the Cameron government is now to be undone. It seems the timing of it seems to be rather curious, but I'll not make a political speech at this point. I just want to say that I actually think it would be important for this committee to find out what is going on elsewhere. And I suppose the other thing I'm interested in attached to that is governments constantly go on about the needing for merging of social services and health. And I would be interested in knowing, and it's not happening, I'd be interested in hearing from our own officers what their antenna is and what the likelihood, or what are the challenges and opportunities that are liable to arise from this further reorganisation.
Thank you, Councillor Atkinson. I think point taken. I hope the committee will be taking that seriously into account in addressing as part maybe of a complementary working group. And we see that those changes, how it's going to impact the things we are already going to investigate, whether it's primary care network or mental health. So we'll try to accommodate it that way. But if you have any further things to say to us, please do write in as well. Thank you, Councillor Atkinson, for this valuable contribution. I have to thank everyone attended this meeting tonight, and as we can see that we are, as a council, we are trying to do our best to hold to account all our key decision makers and the lead members who are passionately and correctly positioned their paper and answered our questions tonight. They have several issues to readdress, especially the data quality concept regarding the integration of data and the quality of that data, which we are going to look at later on. So I have no more to say except to thank you all, thanking members of this committee and all the officers for their hard work and all those participating in this meeting. The next meeting is scheduled, as you can see, on the 19th of April 2021. I wish everyone a very good night and safe environment, and stay well. And thank you, and a very good night to all of you.
Thank you, Chairman.
Thank you.